Beverly asked the question, are there studies on using chemotherapy for multiple sclerosis? What are the results, side effects, and success rates? Beverly, you're actually getting into an area of great interest in multiple sclerosis. We know that in other disorders, for example high blood pressure, that patients may respond to the first medication and some may not, and may need to either be switched to another medication or in some cases have a second medication added to it. Chemotherapy is a specific class of medications that affects the immune system that has been looked at in many different ways. There is one FDA-approved medication that is considered chemotherapy for multiple sclerosis at this time, and that's called Chemotherapy or Mitoxantrone, and that has been reserved for patients who have continued to have progression in their multiple sclerosis. It's a well-tolerated medication. It does have potential side effects, including a small risk, but a real risk of affecting the heart or liver. The success rate varies from patient to patient, as you well understand, in the unpredictability of multiple sclerosis. There's a lot of interest in using medicines that are not FDA approved, but also fall in the class of chemotherapy agents. Imuran or azathioprine, methotrexate, Cellcept are all some names of medications you may have heard of. There are some studies that have looked at these either in combination with some of the FDA-approved injectable medications or by themselves, and they have all shown mixed results. I think when we get into the area of patients who are continuing to progress despite being on one of the baseline medications for multiple sclerosis, what you start to see is the art of medicine, that there are combinations that have been used to treat multiple sclerosis, there are individual responses to those therapies, and that's something I would certainly encourage you to discuss with your neurologist.